In our first example of a fracture, let's go through our stepwise approach in detail. First, as I said, we'll examine the maxillary sinus, looking at the walls first. Starting from the bottom, we'll scroll up looking at our anterior wall. Seems to be smooth throughout, and no obvious fractures. Then, we'll move on to our posterior and anterior lateral walls. Next, we'll move on to our posterior lateral wall. And as we scroll up, we can see a fracture here, as well as some hemosinus. Remember, it's always easy to compare to the contralateral side to compare for an anatomical difference or a true fracture. Here you can see the posterior lateral wall as a nice smooth outline. There's no hemosinus, there's no step-offs or deformities, whereas here you can obviously see a large step-off and a displaced fracture. So right now we're able to say that there's a right posterolateral maxillary sinus wall fracture. We'll continue to scroll up to visualize that fracture in detail and to see if we see anything else going on. After we finish with the sinus, starting from the bottom, we'll then go more posteriorly and look at our arch. As we follow it back, we can see here another fracture. However, as you can tell, it is minimally displaced, if displaced at all. It's quite in line, despite the bone being broken and a triangular defect here. So far we have a right posterolateral wall fracture and a right zygomatic arch fracture. Then we'll move up to look at our ZS and ZF suture lines. Here the lateral orbital wall seems to be intact with no obvious step-offs or defects. In addition, in the ZF region, there are no fractures noted either, just normal suture lines. As always, we want to compare in different views. So pulling up our coronal view. On our coronal view, we'll start off looking at the maxillary sinuses. And as you can see here, there's a fracture in the lateral wall. This was visualized previously on our axial scan. In addition, if we scroll posteriorly, once again we see the fracture in the zygomatic arch, as well as there is a little bit of displacement here, as you can see a step off. This just shows that although it doesn't look very displaced in the axial view, once you compare in two views, you can see that it's a little bit more displaced than we thought. As usual, we would look at the zygoma and all other angles before concluding our scan, including looking at the orbital floor, for which we can see no fractures. We would look at the ZF suture here, the ZS suture internally, and we've already looked at our ZT. Moving on to the sagittal side, we can examine our arch fracture here once again. Normal ZF. A normal floor. It's difficult to see here, but you can actually see the posterolateral wall sinus fracture here. Once again, because the posterolateral wall is in an oblique / sagittal plane, it's difficult to see on a sagittal view. However, you can visualize it here. So at this point, we've seen all three views, and we'd be ready to diagnose this patient with a right posterolateral maxillary sinus wall fracture and a zygomatic arch fracture, both of them on the right side. Let's look at another example here. Let's say that we've done our evaluation completely on the right side, and now we've moved on to the left side. Right away, we can see a fracture of the anterior maxillary sinus wall, as well as the posterior lateral sinus wall. Scroll through, and comparing to the other side, once again, these fractures become quite obvious. Moving on to our arch now, we see a fracture of the zygomatic arch that seems to be non-displaced again. However, as we go more posteriorly, you can see it actually is displaced and is not in line. As we continue to go to superiorly, we see a fracture here, the lateral orbital rim, as well as superiorly here at the superior lateral / superior orbital rim. You can also note a fracture here as well. So let's pull up a second view, namely our coronal view, and now let's take a look at those areas that we saw fractures in before to gain more information from a different view. We have our anterior sinus wall fracture. Our posterior lateral wall fracture. We have our zygomatic arch fracture here, as well as posteriorly, the step off that you can see here. The arch fracture seems to extend all the way through the zygoma itself to the lateral orbital wall, as seen here. In addition, we have a fracture at our ZF suture area, involving not only the lateral orbital wall, but the superior orbital roof as well. So at this point, you're thinking we have fractures of the anterior and posterior lateral maxillary sinus walls, fractures of the zygomatic arch, as well as a lateral orbital wall fracture. All of these put together represent a ZMC type fracture pattern. We also noted a superior orbital roof fracture and a greater wing of the sphenoid fracture, which is what we saw on our axial scan previously. At this point, we'd be ready to diagnose this patient with the left ZMC fracture, as well as a superior orbital roof fracture on the left side and a greater wing of the sphenoid fracture on the left side. As you can tell now, when you're approaching the scan, you're not looking for technically a ZMC type fracture. Rather, throughout your analysis, you're making notes of the different types of fractures you're seeing, and at the end, you're realizing it comes up with a pattern which represents a ZMC pattern type fracture. This is very similar to previously when we spoke about NOE fractures. Now it's time for you to analyze some scans. As you've seen, fractures of the ZMC complex are intricately related with the orbit, the maxillary sinus, and the temporal bone. For this reason, for all these practice scans and going forward, you'll be expected to comment on the absence or presence of fractures of the orbit, ZMC, nasal bones, and maxillary sinus all at once.